child, in my eyes. Okay, some children are smaller than others, but that's roughly the case. And up to, now it becomes a little bit variable. This boy, I would assume, would be roughly the size of a 10-year-old. You can get 13, 14-year-olds that look quite small as well. You can get 13, 14-year-olds that look bigger than me. So it depends on what you see in front of you. Okay? Now, children, when they collapse, most of the time, unlike adults, it's not the heart that's the trouble, it's the lungs. Same with infants. So when it comes to children and infants, the big difference for CPR is you want to give them breaths. 5 rescue breaths at the very beginning. Easier if it's your own child, I know. And the one thing I'd like you to do before you give the breaths is make sure there's no vomit, there's no blood. Okay? Because you can't really breathe into someone who's got vomit, who's got blood. If they have vomit and blood, don't give the breath. But if they don't, you're going to give 5 rescue breaths. I'll demonstrate the 5 rescue breaths for the child. I'm sure Imran has probably already demonstrated for the infant, but we'll get around to the infant in a second. What you want to do is you want to tilt the head a little bit, not a lot, and just look inside the mouth. Make sure there's no blood, there's no vomit. Pinch the nose. And you're going to create a tight seal with your mouth over the mouth. And when you breathe, your chest should rise. I'm going to demonstrate it. 5 rescue breaths. Every breath, you look at the chest. That's 5. Is that okay? Then, when it comes to compressing the chest, children are smaller than adults. If you press with 2 hands, trust us, even the smallest of you is probably going to start breaking ribs. You want to try and give the best effort that you can, but not at too much trauma. So the recommendation for children is one heel. Right-handed, left-handed, doesn't matter. Where? The same place, the center of the chest. Okay? Okay, and you're still going to do the same 30 compressions and 2 breaths. Now, I know in the COVID pandemic world, I told you don't give breaths. For children, please, if you can, if you feel you're comfortable, please do. Alright? For children and infants, their breathing is really important. How are you going to give it? Same way. Count to 30. Get to 30. You're going to give 2 rescue breaths. Okay? Back on the chest.
Same rhythm as adults?
Same rhythm as adults. Same rate. Some of you, I think, have been told 1 Mississippi, 2 Mississippi, 3 Mississippi, and to go down when the number goes. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8. Do that until you get to 30, give 2. Everything else stays the same. The first thing you're going to check is danger. The next thing you're going to do is call for help. AEDs. I think I've demonstrated AEDs for everyone. Is that right? Good. If it's a big child, you can use an AED. If it's a small child, please don't. Okay? Electrical shock is usually too much for a child's body. So they really need help. They really need the ambulance. Okay? Any questions? No? Good.
I have a question.
Yes?
So you mentioned you start off with 5 breaths, and then you do CPR, and then you do 2 breaths each minute.
Yes. So it's 5 in the beginning. That's the one important thing. 5 in the beginning, if you can do it. If there's vomiting, you can't do it. If there's blood, you can't do it. If you don't want to do it, that's fine. Don't do it. But if you can't do it, those 5 breaths make a big difference. Okay? When there's a vomit, don't give the breaths. It's not going to go anywhere. If you were in my emergency department, I will be able to suck out the vomit. But if you're out on the road, you can't. Don't give the breath. Okay? Just do normal CPR. So just a concussion. Okay? If you can't get the vomit, don't do it. There's blood, don't do it. Does that make sense? Okay. Management of choking is exactly the same. Okay? So Heimlich procedure is a little bit easier with children because they're usually a bit smaller. You get to the right position. Hand just under their chest. Hold it. Check. 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 5 times. Doesn't work? They're still choking. Check. Check. When you're doing this, don't do it like this. I need to be leaning forward. If you can do that safely with one hand, that's fine. If not, get someone else to help you. Sit them on your lap, whatever it takes. Between the shoulder blades. Really hard. You're not trying to protect them from a bruise. You're trying to get something that might be threatening their life out. Priority. Save the life, okay? Recovery position is the same in a child as it is in an adult. Right hand to cheek, leg up, onto the left side. That's only if they're unconscious and they're breathing. If they are not breathing, please do not disturb it. Does that make sense, everybody? Okay. Infant. Might as well do that at the same time. Anything to roughly the age of 1 year. Infant. Again. See? Choking.
William is demonstrating.
Very good. CPR on an infant. Very scary. Okay? Extremely scary because a child not breathing is extremely scary. But I want you to just try to remain calm. It's difficult when it's your own child. Best thing to do, hold them. Okay? There's no point getting them down on the ground, it's too low. Hold them, bring them closer to your mouth. 5 rescue breaths. For an infant, the biggest reason they go into cardiac arrest is something's wrong with their lungs. They need the oxygen. Usually they've choked, and we'll talk about choking in a minute. But it's 5 rescue breaths if they are not breathing. Easiest with the child, it's sometimes difficult to pinch the nose and just go for the mouth. You've got big mouths, all adults have big mouths, cover both the nose and the mouth. You should still see their chest move. Alright? 5 rescue breaths. Check. 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 5. Does that make sense? Compressions on an infant. How do you do compressions on an infant? It's not with the heel of your hand. 2 fingers. Alright, they're tiny. Is it the middle of the chest? Is it in the top of the tummy? Sometimes children is difficult to tell. If they're chubby, it's difficult. Don't worry too much about it. Just roughly in the center, okay? One other big difference is not 30. It's 15. And then 2 breaths. Because the breathing is extremely important. Do it as fast as you want, as slow as you want. It doesn't really make a difference. The breaths are important. Obviously, try and do it at a regular rhythm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9. The beauty of this technique, I can go get up. Alright? With a child, you can't do it. But with an infant, you really need to get them to the hospital. If there's an ambulance coming, you stay where you are. If there's not an ambulance coming, you go. You take the infant with you, but you could keep walking, and you can do everything you need to do.
What to do if the child, the baby start to
Cry?
breathe? Yeah, cry.
Great.
So the baby stop first.
Stop the CPR. If they're crying, they're breathing. Take them to the emergency department. They still need to go. But stop CPR. Okay. Questions so far? CPR.
Someone asked, is there a recovery position for the infant?
That's the best I would recommend. Because there's no real safe position for infants. They roll, they're not usually compliant, and you don't have this facility all the time. Some infants' hands do reach, some of them don't. Their legs are floppy. I would honestly recommend if you can get them to a slightly seated position, not straight, and definitely not like this. The reason I say that is this is the sort of the best position for breathing. Okay? And it's also something you can carry. Okay? Obviously, if you're on a bed, it's on a bed. And that's fine. If you can't carry them and you're worried, that's fine. but if you can, just slightly sit it up, slightly. Does that make sense? Okay. Choking. Imran, you're an expert at this.
What do you demonstrate here?
I would like you to demonstrate choking. The
Okay.
choking baby. Like I said, respiratory wise, problems with breathing is usually the biggest problem with babies. There's slight differences to choking babies.
So obviously the infant is actually quite small, so you can carry them. Place them on your forearm. You have to extend the neck to make sure that the airway is open. Right? And then you give back those here.
Extend is like that. Okay?
So
Not a lot.
these two fingers help to push the jaw up. So make sure you're not actually in the mouth or closing the mouth. You just give back those. You can actually see the teeth come out.
So, oh, 5. It's the same as children. It's 5 on the back. Every time you give a blow, you check, blow, you check, blow, you check. The reason why you check sometimes it's a piece of fruit or whatever is if it's in the mouth, pick it up. Okay? It's easy. Or sweep it out. And that's really important. So if the 5 blows don't work, you then move on to the chest. But unlike a child where you can do this, or with an adult you can do this,